Just looking at something you said earlier, Chris, around grit and really being resilience and, just this tendency just to can continue despite the odds or despite the dynamic environment. Could I get you to speak to how you test for resilience and indeed evaluate resilience in potential clinicians?
I'll give you the example, which is in the hospital. We think that the pressure most people are facing is actually around burnout and the risk of moral injury. And so how does one conduct themselves in such a climate? And I can't speak for the hospital systems where you are, but certainly in the Southern Hemisphere, we're under quite a lot of pressure in the midst of winter. So we look to see how people navigate that environment. Some of the things that we will ask, and again, these are open source questions, is, how can somebody give us an example of a time when they've had to use their resilience and what did that look like? We're trying to uncover, I suppose, what are some of the things that help them to recover. So those are the things we're exploring. The other thing we're exploring is how much of their mindset is around, I suppose, growth. And that comes to that concept of grit. But is it possible to measure one's commitment to growth and one's willingness to kind of learn? And I think that's a really interesting area to explore.